When you look at studies, children tend to have food allergy in the rate of 6 to 8%, and about 1 to 2% of adults have food allergy. If you ask the general public how many people have food allergies, about 20 to 25% will say they do. And mostly that's from misconceptions. Maybe they really have an intolerance or some sort of idiosyncratic reaction. The specific allergens affected really depend upon the societal eating pattern. In the United States, in infants, milk tends to be the most common, and peanut in adults. Dye and preservative allergy tends to be really rare, and it really is the exception to the rule. It's not uncommon for a patient with concerns for food allergy to come in and say, I know it's that red dye or whatever, but really that is the exception, and testing is not readily available either. Fatal food anaphylaxis is a concern. There's about 150 deaths per year. Risk factors for death from food anaphylaxis are underlying asthma, delayed epinephrine administration, symptom denial, and previous severe reaction. Interestingly, the food causing the death is often a known allergen, and this really shows the importance of skilled guidance on avoidance measures for patients. Key foods involved with fatal anaphylaxis are peanuts, tree nuts, and shellfish. Another consideration is that many patients with food anaphylaxis have a biphasic reaction. So within about 2 hours, about a third of patients will have a second anaphylactic reaction. So it's important to observe patients after anaphylaxis for at least 2 hours or more. Another risk factor for death is lack of cutaneous symptoms. Practitioners readily recognize hives and they say it must be allergy. But many anaphylactic reactions don't have any cutaneous symptoms. In fact, one of the most common associated with death was initial GI symptoms. Patient is at a restaurant, they get stomach upset, they go to the bathroom. Once they're in the bathroom, then they have laryngeal edema or circulatory collapse.